Hi, I'm Dr. Shagufta. I'm lactation consultant and childbirth educator, and our clinic is HerWellness, which is located in Vijaya Bank layout, Bangalore. Key of successful breastfeeding is being informed about breastfeeding. And the journey doesn't start once you deliver a baby. It starts much more earlier when you are in mid of your pregnancy. When you know everything about breastfeeding at the time when you delivered and you're processing with breastfeeding, it will be much more easier. Like once you deliver your baby, there has to be within 1 hour breastfeeding. That is called as golden hour of breastfeeding. Once the baby is delivered, the baby should be placed on your breast and the baby should get skin to skin, and the skin to skin will help the baby to get heat from the mother and the baby will get settled down. In within 10 to 15 minutes, once the mother and baby settle down, baby will get direct latch. If you have visited a lactation consultant earlier, they'll be able to explain you how exactly your process of breastfeeding gonna happen, how the step by step you will be helping your baby to come to the skin to get self-latch. And if you get self-latch within 1 hour, you know that your production will get established so well and you will most probably not have any issue furthermore when you are processing with the breastfeeding journey. Sometimes what happened at the time of delivery, when you delivered immediate, there could be possibility of you'll have a milder edema in your body, milder swelling in your body. And at that time when somebody comes and evaluate your breast, it might look like you have flat nipple or inverted nipple just because of your other body part is little swollen, but it might not be correct. It's misdiagnosis at the specific time. After 2 or 3 days it might not be as same. So getting examined early before feeding, before even delivering, it will be more accurate and more helpful for you to know how exactly your body is prepared for the breastfeeding. The other major concern which most of lactation consultant, they can help you when in the process of breastfeeding, when you have pain, discomfort, nipple crack, and you get to know if the baby is not being placed properly and if there is any anatomical variant on the mother like inverted nipple, flat nipple, or any anatomical variant in the baby like a tongue tie, lip tie, if you know these are the things is there along with, so definitely your lactation consultant can guide you and can tell you how exactly the process, and it is much more easier. It's not that you should be suffering throughout your breastfeeding phase. You should be knowing in advance so you can really correct it, and definitely it's much more easier than we expect. And finally, one major concern usually which we see regularly, that is this is how, which is very common. Most of new mother they come and they say, at our time when we delivered a baby, we never had this kind of issue. How come this generation, most of every mother says, my breastfeeding journey is not good, or I'm not able to process my breastfeeding, I have low supply, and we never face this issue. By this generation only facing this issue, which is really very correct. At the time when this generation, the current generation was growing from the childhood to puberty to the adulthood, there was very least exposure just because of our community. Right now we are in nuclear community. If you compare your mother time, they were on joint community. So at that time they had such a good exposure. Every house there used to be one mother who used to feed. And right now if I'll ask you how many times you have seen, how many mother you have seen who are breastfeeding, I think no, you do not have any single mother you can say that yes, I have seen. So you have not seen and you do not know how to do this. So definitely relearning is needed. And if you know this all journey of the breastfeeding, your lactation consultant help you, hold your hand and take you the path to complete and have a successful breastfeeding experience.